This is a guide on how to use the QMD and diabetes dashboard. If you have any questions, please don't hesitate to ask your provider or clinic manager. .dm is a universal quick text within Centricity. It is a good habit to add this to the beginning of every note for patients with known diabetes so that the provider can quickly assess a patient's diabetes metrics. To add the QMD form, you click Add on the Forms list and type QMD. You'll want to make sure to add the QMD HTML form. Within the QMD form, you'll notice a Diabetes A1C Control heading, and below it is the Diabetes Dashboard. If you click on that, it'll add that form to the list for that visit. All of that patient's diabetes metrics will appear within the Diabetes Dashboard. The metrics that are met will be green, while those that are unmet will be red.
A1C is a number that gives us an estimate of someone's average blood glucose. Say someone comes into clinic and they have an A1C of 10.2, that means on average their blood sugar has been about 268, which is pretty high. Most diabetics have an A1C goal of between 6 and 8, depending on their age and their health status. We check the A1C about every 3 months because that's how big of a window it gives us a glimpse into, and because that's how often insurance covers us to check it.
Retinopathy is a major cause of morbidity in patients with diabetes. It is important to screen patients with diabetes yearly for the development of retinal disease.
You'll want to make sure you enter the correct date on which they had their annual eye exam performed. And once entered, click Commit to Flowsheet to permanently add it to their chart.
We perform annual diabetic foot exams to check for signs of infection, injury, and bone abnormalities. Nerve damage, known as neuropathy, and poor circulation are common complications of uncontrolled diabetes. To document the foot exam, you click on the Open Diabetes Exam form within the Diabetes Dashboard. You can also access this form by clicking on the Physical Exam form from the Forms list, and then click on Diabetes Exam tab at the top of the screen.
Diabetic kidney disease is a major cause of chronic kidney disease. Microalbuminuria literally means tiny amounts of protein in the urine. Increased urinary protein excretion is the earliest clinical finding of diabetic nephropathy. We should check diabetic patients' urine for microalbuminuria yearly in a random urine sample.
To enter in the diabetes metrics, you can click Edit Flowsheet at the top right of the Diabetes Dashboard. You'll then want to change the view by selecting Diabetes from the drop-down menu. After that, you'll click New to input new values for the diabetes metrics and make sure you input today's date. The metrics you'll want to focus on are A1C, microalbumin, diabetic foot exam, and PNEUMOVAX.
For patients with chronic conditions like diabetes, a single dose of PNEUMOVAX is indicated for adults ages 19 to 64 years because this chronic disease increases the risk of pneumococcal infection or serious complications should an infection occur. If a patient is diabetic and over 65, they should receive a second dose of PNEUMOVAX at least 5 years after the first dose.
Once you've entered in the metrics for that visit, you will be able to see them updated in the flowsheet. You can find the flowsheet by going to the patient's chart and clicking Flowsheet from the left pane. Again, change the view by selecting Diabetes from the drop-down menu, and the updated metrics should appear listed for that particular date.